For decades, you've been turned into a perfect cash machine for a multi-billion-dollar pharmaceutical industry. And their weapon of choice is that familiar blood pressure cuff in every doctor's office.
The needle
You've been
indicates
trained
a
to
high
panic
systolic
whenever
reading.
your
This
systolic number
suggests
creeps
elevated.
past an
The
invisible
measured level is
threshold,
increasing over
to
time.
obediently starve yourself of salt until food becomes a tasteless punishment, and to blindly
Remembrance
swallow
in
daily
daily
pills
medication.
like a religious
Take your pill
ritual
with.
to ward off a stroke. But here is the truth. The medical boards and pharmaceutical giants never wanted you to find out. Almost everything you've been told about high blood pressure is a carefully engineered statistical lie. This system hasn't just misunderstood the human body. It has actively redefined what it means to be normal, just to justify medicating millions of perfectly healthy people. It's time to tear up that outdated medical chart and look at the actual science. Here are 42 secrets about your blood pressure they've been hiding from you. 1. You've been told that eating salt is the direct cause of high blood pressure and impending heart attacks. You believe you must restrict your sodium intake to absolute minimums, suffering through bland, tasteless meals to save your heart. Every major health organization, doctor, and dietary guideline has drilled this anti-salt messaging into your brain since you were a child. The truth is, drastic salt restriction actually increases your risk of cardiovascular death. Your kidneys are masterful at filtering excess sodium, but when you deprive your body of salt, it panics and activates the renin-angiotensin-aldosterone system. This survival mechanism actively constricts your blood vessels and spikes your insulin resistance to retain whatever sodium is left. This medical myth stems from the deeply flawed 1988 Intersalt study, where researchers manipulated data from isolated Amazonian tribes to push a narrative, conveniently ignoring that high salt-consuming nations like Japan have the longest life expectancies. You've been punishing your taste buds for decades over a cheap statistical magic trick. 2. You believe that 120/80 is the universal gold standard for a healthy human being, regardless of who you are. You probably panic and think you're stroking out if your reading hits 130 or 140. This magical 120/80 ratio is plastered on every clinic wall, pre-programmed into fitness apps, and treated as gospel by your local pharmacist. The reality is that this number is a moving business target, not a biological law. For generations, normal systolic blood pressure was calculated as 100 plus your age. But in 2017, the American Heart Association abruptly lowered the threshold for hypertension to 130/80. By simply moving the goalposts, they instantly labeled tens of millions of perfectly healthy adults as sick and in need of medication. This overnight change wasn't driven by a sudden biological mutation in humans, but by guideline committees heavily populated by individuals with financial ties to pharmaceutical companies. You didn't suddenly get sicker. The industry just made your health illegal. 3. You've been told that high blood pressure is a standalone disease attacking your body like a virus. You believe your only goal is to brutally force that number down using pharmaceutical drugs. Doctors constantly talk about managing your hypertension as if the number itself is the root cause of all your cardiovascular problems. Turns out, high blood pressure isn't the disease. It's your body's desperate survival response to damaged blood vessels. When your arteries become stiff and inflamed from a poor diet and insulin resistance, your heart is forced to pump harder just to get oxygen and nutrients to your brain and kidneys. High blood pressure is literally your body trying to keep your organs alive through a hardened plumbing system. The medical industry ignores this because telling you to fix your insulin resistance doesn't generate recurring monthly revenue. Medicating away the pressure without fixing the pipes is like taking the batteries out of your smoke detector and pretending the fire is out. 4. You've been taught that when it comes to blood pressure, sugar just makes you fat. but leaves your arteries alone. You meticulously scrape the salt off your pretzels while washing them down with a giant soda. Nutritional labels and dietitians scream about sodium content while completely ignoring the massive amounts of refined carbohydrates in heart-healthy foods. The brutal twist is that refined sugar, specifically fructose, destroys your blood vessels and spikes your blood pressure far worse than salt ever could. When fructose hits your liver, it creates a massive spike in uric acid, which directly destroys nitric oxide, the vital molecule that keeps your blood vessels relaxed and wide open. Without nitric oxide, your arteries clamp shut, and your blood pressure skyrockets. This lie was bought and paid for in the 1960s when the Sugar Research Foundation paid Harvard scientists to blame heart disease entirely on fat and sodium. You've been dodging pretzels to save your heart, only to give yourself hypertension with a glass of apple juice. 5. You imagine that as you get older, your blood pressure should magically stay the same as it was when you were 20. You force your elderly grandparents to take aggressive medications to drag their numbers down to 120/80, even if it makes them dizzy and weak. The entire geriatric healthcare system treats age as irrelevant, enforcing the exact same blood pressure targets on an 80-year-old as a college student. The physiological reality is that artificially lowering blood pressure in the elderly is a slow-motion death sentence for their brains. As we age, arteries naturally lose their elasticity and stiffen, meaning the heart must pump at a higher pressure, often 140 or 150, just to push blood up into the brain. Forcing that pressure down with drugs directly starves the brain of oxygen, leading to fainting, falls, and severe cognitive decline. This deadly protocol exists because medical boards blindly extrapolated data from middle-aged test subjects onto nursing home residents. Your doctor might be thrilled with your grandfather's perfect chart, even if your grandfather no longer remembers the doctor's name. 6. You believe that a sudden spike in your blood pressure at the doctor's office is just a harmless quirk, and that your doctor is smart enough to account for it. You obediently stick your arm out for the nurse the second you sit down, after rushing through traffic and arguing with the receptionist. Standard medical practice uses this single, isolated 2-minute reading as definitive proof of your overall cardiovascular health. The truth is, millions of people are falsely diagnosed and medicated for life because of white coat syndrome. The sterile environment, the smell of rubbing alcohol, and the authority of the doctor trigger an involuntary fight-or-flight cortisol spike that temporarily shoots your pressure through the roof, even if you are perfectly normal the other 23 hours of the day. The only scientifically accurate way to diagnose hypertension is a 24-hour ambulatory monitor, but clinics rarely use it because the rapid-fire 10-minute appointment model maximizes billing. You're basically paying a monthly subscription for toxic drugs just because your nervous system hates waiting rooms. 7. You've been advised that taking daily calcium supplements is harmless and strictly for keeping your bones strong. You swallow massive horse pills of synthetic calcium, completely unaware of what it does to your cardiovascular system. Health magazines and mainstream doctors heavily push these supplements to women over 40 as a mandatory daily routine. The lethal secret is that taking calcium without vitamin K2 is the fastest way to turn your blood vessels into stone and drive your blood pressure permanently off the charts. Without K2 to guide calcium into your skeleton, the excess mineral floats in your bloodstream and calcifies inside your arterial walls. Once your arteries literally turn to bone, they lose all ability to expand, forcing your heart to blast blood through rigid pipes. This happens because modern medicine is deeply siloed. The bone doctor prescribes the calcium, and the heart doctor gets to deal with the calcified arteries years later. Keep popping those chalk pills, and you'll have a wonderfully strong skeleton trapped inside a broken cardiovascular system. 8. You think chronic stress from your horrible boss or your mortgage is just in your head and only causes headaches. You tell yourself to just push through it, believing emotions have no mechanical impact on your blood pressure readings. Hustle culture and the corporate world treat stress as a badge of honor, completely divorcing mental states from physical disease. The shocking reality is that chronic stress physically remodels your arteries and permanently elevates your blood pressure. Constant stress floods your system with cortisol and adrenaline, which overactivates your sympathetic nervous system and forces your kidneys to hoard massive amounts of sodium. Over time, this constant chemical barrage actually causes the smooth muscle in your blood vessels to thicken and narrow, physically adapting to a permanent state of war. The medical establishment ignores this because you can't patent meditation, quitting a toxic job, or finding peace. It's vastly more profitable to blame your genetics and sell you a beta blocker to numb your nervous system. 9. You believe that diuretics, or water pills, are a gentle, perfectly safe first resort for lowering blood pressure. You pop this cheap pill every morning, assuming it just makes you pee a little more to relieve the pressure in your pipes. Diuretics are the undisputed, globally recommended first-line treatment for almost anyone newly diagnosed with hypertension. The ugly truth is that these pills drain your body of critical minerals and create the perfect metabolic environment for type 2 diabetes. By forcing your kidneys to flush water and sodium, diuretics simultaneously strip your body of potassium and magnesium, the exact minerals your heart needs to beat correctly, and your arteries need to relax. Furthermore, draining the water makes your blood thicker and more prone to clotting, while the severe potassium drop directly paralyzes your pancreas from producing insulin. They became the gold standard purely because they are incredibly cheap to manufacture and show an immediate drop on the monitor. You are lowering your blood pressure by turning your bloodstream into thick sludge and breaking your pancreas. 10. You've been convinced that drinking massive amounts of plain water, a gallon a day or more, will flush your system and naturally keep your blood pressure low. You carry around a giant jug with motivational timestamps, forcing yourself to chug water even when you aren't thirsty. Fitness influencers and wellness blogs have turned extreme hydration into a cult-like requirement for health. The physiological slap in the face is that overhydrating with mineral-depleted water actually causes severe electrolyte imbalances that trigger heart palpitations and erratic blood pressure. Your vascular system relies on a delicate osmotic balance of sodium, potassium, and water. Flooding it with purified water dilutes your blood sodium, hyponatremia. Your cells swell up, and your kidneys are forced into overdrive, creating massive systemic stress that actually strains your cardiovascular system. The 8 glasses a day myth was a marketing invention by the bottled water industry in the 1990s to convince humans we are too stupid to understand our own thirst. Congratulations, you're stressing your heart just to become a highly efficient urine factory. 11. You think beta blockers are a miracle drug that simply calms your heart down with zero metabolic consequences. You take them happily, blaming your sudden weight gain and chronic exhaustion on simply getting older. Doctors hand these out like candy to executives and anxious patients to keep their heart rates artificially suppressed. The twist is that beta blockers literally shut down your metabolism, making you fat, tired, and deeply insulin-resistant. By blocking adrenaline, These drugs don't just slow your heart, they block your fat cells from releasing stored energy, meaning your body literally cannot burn fat. You end up gaining weight, which makes your underlying metabolic health worse, ultimately requiring even more medication. This class of drugs was aggressively marketed as a cure-all for stress-induced hypertension, burying the metabolic side effects deep in the fine print. You didn't lose your energy because you hit 40. You lost it because you swallowed a chemical mute button for your metabolism. 12. You've been told that standard vegetable oils like canola, soybean, and corn oil are heart-healthy alternatives to butter that will keep your blood pressure down. You proudly buy cooking oils with the little red heart logo, believing you are doing your arteries a massive favor. Every major health organization since the 1970s has urged you to replace animal fats with these highly processed seed oils. The reality is that industrial seed oils are liquid inflammation that slowly roast your endothelial lining. These oils are packed with unstable omega-6 fatty acids that, when heated, oxidize and trigger massive systemic inflammation in your blood vessels. This inflammation damages the arterial walls, leading to stiffness and plaque buildup, which forces your blood pressure higher and higher. The entire seed oil empire was built on a lie funded by the cottonseed and soybean industries, who needed to find a human use for their toxic industrial machine lubricants. You think you're cooking with love, but you're actually frying your arteries in industrial waste. 13. You believe that a dry, hacking cough is just a random, annoying allergy and couldn't possibly be related to your blood pressure medication. You buy over-the-counter cough syrups for months, completely oblivious to the real cause. When patients complain about this cough, doctors often brush it off or suggest it's a seasonal cold. The truth is, if you are taking an ACE inhibitor for your blood pressure, that pill is actively flooding your lungs with an inflammatory chemical called bradykinin. ACE inhibitors block the enzyme that constricts blood vessels, but that same enzyme is responsible for breaking down bradykinin in your respiratory tract. When it builds up, it causes a chronic, maddening cough that no cough syrup can fix. Pharmaceutical companies knew about this from day one, but deemed a ruined quality of life an acceptable trade-off for a slightly better blood pressure reading. You're choking on a synthetic chemical buildup just to make the clinic's computer screen flash a green number. SHAF, formatting as 14. 14. You assume that sleep apnea is just loud snoring and only bothers your spouse, having absolutely nothing to do with your rising blood pressure. You view a CPAP machine as an embarrassing inconvenience rather than a cardiovascular necessity. Most general practitioners will immediately prescribe blood pressure meds without ever asking you a single question about your sleep quality. Here is the nightmare. Waking up gasping for air hundreds of times a night puts your heart through a literal torture chamber, driving your blood pressure to lethal levels. Every time your airway collapses, your brain panics, dumps adrenaline into your bloodstream, and violently spikes your blood pressure to wake you up and prevent you from suffocating. This creates a state of chronic hypertension that absolutely no pill can cure, because the root cause is mechanical suffocation. The medical system prefers prescribing pills because sleep studies are tedious and don't fit into a rapid billing cycle. You are literally suffocating in your sleep, and your doctor's solution is to give you a pill for the panic. 15. You've been told that avoiding the sun completely and slathering on sunscreen is the only way to stay healthy, and that sunlight has zero impact on your heart. You hide indoors, terrified of UV rays, believing your skin is the only organ affected by the sun. Dermatologists and skincare companies have successfully terrified the entire Western world into a state of chronic sun avoidance. The shocking reality is that avoiding the sun is a primary, unrecognized driver of the modern hypertension epidemic. When sunlight hits your skin, it triggers the release of massive stores of nitric oxide directly into your bloodstream, which immediately dilates your blood vessels and safely lowers your blood pressure. Furthermore, the vitamin D produced is essential for regulating the enzymes that control vascular tone. The aggressive anti-sun campaigns were funded by cosmetic and sunscreen conglomerates who wanted you terrified of the sky so you'd buy their chemical lotions. You've been hiding from the exact natural mechanism designed to keep your arteries wide open. 16. You think that simply taking a statin to lower your cholesterol will magically fix your high blood pressure too, as if all cardiovascular issues are just one big blob. You trust the pharmaceutical ads that imply cleaning up bad cholesterol will leave your pipes squeaky clean and relaxed. Many doctors prescribe statins and blood pressure meds as a mandatory combo meal for anyone over 50. The brutal pivot is that statins actually increase calcification in your arteries, making them stiffer and potentially driving your blood pressure up over time. By aggressively blocking cholesterol production, statins also block the synthesis of vitamin K2 in the body, the exact vitamin needed to keep calcium out of your arterial walls. The pharmaceutical industry heavily marketed the combo pill approach, not because the biology makes sense, but because patenting two drugs together creates a brand new, highly profitable patent. You are taking a cholesterol pill that turns your arteries into rigid, calcified tubes. 17. You believe that eating red meat is a surefire way to clog your arteries and send your blood pressure soaring. You dutifully order the dry grilled chicken or the tragic soy patty to protect your heart. Mainstream media and pseudoscientific documentaries constantly vilify beef as the ultimate cardiovascular villain. The truth is, high-quality, grass-fed red meat is packed with potassium, magnesium, and bioavailable amino acids that actively support healthy blood pressure. The myth that meat causes hypertension came from lazy epidemiological studies that lumped people eating fresh steak in with people eating highly processed, chemical-laden fast food hot dogs alongside large sodas and fries. The blame was pinned on the meat instead of the toxic industrial processing and the massive sugar load consumed alongside it. You are depriving your heart of nutrient-dense fuel because bad scientists couldn't tell the difference between a cow and a factory-made sausage. 18. You assume that mouthwash is a brilliant hygiene habit that protects your health by killing all the bad bacteria in your mouth. You aggressively swish with neon blue antiseptic liquid every morning, loving the burning sensation of total cleanliness. Dentists and aggressive television commercials have convinced you that a sterile mouth is a healthy mouth. The terrifying reality is that antibacterial mouthwash massacres the essential oral microbiome that is entirely responsible for producing the nitric oxide that lowers your blood pressure. The bacteria on your tongue convert dietary nitrates into nitrites, which your stomach then turns into the nitric oxide that dilates your blood vessels. Kill the bacteria, and your blood pressure spikes almost immediately. Mouthwash companies knew they were creating a biological dead zone, but marketed it as fresh breath to sell cheap alcohol and synthetic chemicals. You are literally rinsing your way to hypertension every single morning. 19. You've been warned that drinking coffee will give you chronic high blood pressure and that you must switch to decaf for your heart's sake. You angrily sip your sad, watery decaf, believing you've made a massive sacrifice for longevity. Doctors routinely tell hypertensive patients to quit coffee cold turkey based on decades-old outdated advice. The plot twist: regular coffee consumption actually reduces your long-term risk of heart disease and does not cause chronic hypertension. While caffeine causes a tiny temporary bump in pressure for an hour, Coffee is actually one of the most potent sources of vascular-protecting antioxidants in the Western diet, which improve endothelial function over time. The anti-coffee propaganda originated from old studies that failed to account for the fact that heavy coffee drinkers in the 70s were also incredibly heavy chain smokers. You gave up the one joy of your morning routine because researchers forgot to ask if test subjects were smoking a pack a day. 20. You think that having a normal BMI or being skinny means you are completely immune to high blood pressure. You look in the mirror, see no belly fat, and assume your cardiovascular system is pristine. Society equates thinness with metabolic perfection, and doctors rarely scrutinize the diets of skinny patients. The hidden truth is a condition called TOFI, thin on the outside, fat on the inside, where visceral fat wraps around your organs and chokes your kidneys, driving blood pressure sky high. You can be a size 0, but if your diet is full of refined carbs and seed oils, your organs are drowning in inflammatory fat that stiffens your arteries just as severely as someone who is visibly obese. This misconception thrives because the medical system relies on the incredibly flawed BMI scale, a 19th-century mathematical equation created by a sociologist, not a doctor. Your skinny jeans might fit perfectly, but your arteries are suffocating in invisible fat. 21. You believe that checking your blood pressure the second you sit down in the doctor's chair provides an accurate reading. You barely have time to uncross your legs and catch your breath before the cuff inflates. Clinic protocols normalize this rushed, drive-by approach to taking your vitals as just efficient medical practice. The reality is that failing to sit quietly with your feet flat on the floor for at least 5 minutes can artificially inflate your reading by up to 15 points. Furthermore, talking, having a full bladder, or having the cuff placed over clothing completely invalidates the result. Yet nurses do this millions of times a day. Clinics run on volume, and taking 5 minutes of silence per patient would destroy their daily billing quota, so they accept junk data as medical fact. You're being diagnosed with a chronic illness because the clinic was too greedy to let you pee and sit still for a few minutes. 22. You've been told that a slight deficiency in potassium is no big deal, as long as you eat a banana every now and then. You focus 100% of your energy on avoiding sodium, completely ignoring your potassium intake. The medical establishment rarely tests for intracellular potassium, keeping the focus entirely on restricting salt. The biological truth is that a lack of potassium is actually the primary driver of hypertension, far more than an excess of sodium. Your cells operate on a sodium-potassium pump. When you lack potassium, found in massive amounts in meat, avocados, and greens, not just bananas, your body physically cannot relax the smooth muscle tissue of your blood vessels. This imbalance became an epidemic when humanity shifted from a whole food diet rich in natural potassium to a processed food diet loaded with refined salt. You are obsessing over the brake pedal while completely ignoring the fact that your car has no steering wheel. 23. You assume that the cuff the doctor uses to measure your blood pressure is a universally perfect tool that fits everyone flawlessly. You never question the nurse when they wrap a standard cuff around your arm, trusting the equipment implicitly. The medical device industry portrays the standard sphygmomanometer as infallible technology. The shocking flaw is that using a cuff that is too small for your arm, a rampant problem, especially for muscular or overweight individuals, will artificially overestimate your blood pressure by a massive margin. If the cuff is too tight, the machine has to exert extreme pressure to occlude the artery, registering a terrifyingly high, completely fake systolic number on the screen. Hospitals buy the standard adult size in bulk to save money, rarely bothering to switch to the large or extra-large sizes sitting in the supply closet. You're swallowing toxic beta blockers simply because the hospital was too lazy to buy a bigger piece of Velcro. 24. You think that eating frequent, small meals throughout the day is the ultimate biohack to keep your metabolism humming and your blood pressure stable. You carry around granola bars and constantly snack, believing you are preventing vascular stress. Fitness gurus and snack food companies have preached the 6 small meals a day gospel for 20 years. The metabolic truth is that constant snacking keeps your insulin levels permanently elevated, which signals your kidneys to never stop reabsorbing sodium, driving your blood pressure constantly upward. Every time you eat, you trigger an insulin response. When insulin never falls, your sympathetic nervous system stays locked in a state of high alert, stiffening your arteries. This disastrous advice was heavily promoted by the processed snack industry to ensure you never stopped buying and consuming their products. Human beings evolved to fast between meals. You're giving yourself hypertension by eating like a grazing cow. 25. You believe that magnesium is just a niche supplement for hippies and athletes, completely irrelevant to your serious cardiovascular health. You trust the pharmaceutical drugs to do the heavy lifting, viewing minerals as weak alternatives. Mainstream cardiology guidelines barely mention magnesium, focusing entirely on patented chemical interventions. The undeniable fact is that magnesium acts as nature's ultimate calcium channel blocker, physically relaxing the arterial walls and safely lowering blood pressure. When you are deficient in magnesium, as over 70% of the modern population is due to depleted soils, calcium floods your vascular, smooth muscle cells, causing them to cramp and constrict into a state of chronic hypertension. The pharmaceutical industry literally modeled blockbuster blood pressure drugs, synthetic calcium channel blockers, after the exact mechanism of magnesium, but they sell you the patented chemical instead of the cheap mineral. You are paying thousands of dollars for a synthetic copy of a nutrient your body is begging for. 26. You've been told that a plant-based vegan diet will miraculously cure your high blood pressure by eliminating all animal fats. You force yourself to eat ultra-processed soy sausages and fake meat patties, believing you hold the moral and cardiovascular high ground. Netflix documentaries bankrolled by vegan investors have convinced millions that meat is the sole cause of hypertension. The brutal reality is that modern vegan diets are often packed with refined carbohydrates, highly inflammatory seed oils, and massive amounts of sodium used to make fake meat taste real. These ultra-processed plant foods trigger wild insulin spikes and severe systemic inflammation, completely destroying your endothelial function and raising your blood pressure. The food industry capitalized on the vegan trend not to save animals or your heart, but because processing cheap soy and peas into premium-priced fake meat yields astronomical profit margins. You traded a natural steak for a hyper-processed science experiment that is actively stiffening your arteries. 27. You assume that diastolic pressure, the bottom number, is the only one that truly matters for heart disease. You breathe a sigh of relief if your bottom number is 80, even if your top number is creeping up. Older doctors and outdated textbooks heavily emphasize the diastolic reading as the ultimate predictor of cardiovascular doom. The physiological twist is that an elevated systolic pressure, the top number, combined with a low diastolic pressure, a wide pulse pressure, is actually the most dangerous indicator of severe arterial stiffness. If your top number is a 150, but your bottom number is 70, it means your arteries have turned to rigid lead pipes that cannot absorb the shock of your beating heart, putting you at immediate risk for a stroke. The medical establishment focused on the bottom number for decades simply because it was easier to measure with early 20th century technology. You are celebrating a good bottom number while your arteries are shattering under the systolic pressure. 28. You believe that heavy metal toxicity is a problem only for 19th century factory workers, completely unrelated to your modern blood pressure. You assume your tap water and daily environment are pristine and perfectly safe. Health authorities rarely test for environmental toxins unless you show up in the ER with acute poisoning. The hidden nightmare is that chronic low-level exposure to lead and cadmium found in old plumbing, cheap imported ceramics, and certain crops silently accumulates in your kidneys and destroys their ability to regulate blood pressure. Even tiny amounts of lead inhibit nitric oxide production and cause severe vascular constriction, acting as a ghost trigger for hypertension that no doctor ever looks for. Governments and industries have downplayed the devastating effects of legacy heavy metals because the cost of replacing global infrastructure is financially catastrophic. Your doctor is treating your blood pressure with a pill while you are slowly being poisoned by your own kitchen faucet. 29. You've been taught that drinking beetroot juice to lower blood pressure is just a hippie myth and a waste of money. You laugh off natural remedies, trusting only the little white pills from the pharmacy. Mainstream medicine often dismisses food-based interventions as weak, anecdotal pseudoscience. The scientific fact is that the naturally occurring nitrates in beets are converted directly into nitric oxide in your body, providing a massive, clinically proven drop in blood pressure that rivals prescription medications. Elite athletes use it legally to dramatically improve blood flow and oxygen delivery, but cardiologists rarely mention it to patients. The pharmaceutical industry cannot patent a root vegetable, so they refuse to fund the large-scale clinical trials required to put beetroot juice into the official medical guidelines. You're ignoring one of the most potent vasodilators on Earth simply because it comes from the dirt instead of a lab. 30. You think that taking over-the-counter painkillers like ibuprofen or naproxen is perfectly safe for your heart. You pop NSAIDs for every minor headache or joint pain, believing they are as harmless as candy. These drugs are available in massive bottles at every grocery store, giving a false illusion of absolute safety. The terrifying truth is that NSAIDs actively constrict blood vessels and severely damage your kidney's ability to filter sodium, which can spike your blood pressure to stroke-inducing levels within weeks. By blocking the prostaglandins that reduce inflammation, NSAIDs also accidentally block the exact chemicals your kidneys use to keep your blood pressure stable. The FDA only issued black box warnings for cardiovascular risk after millions of people had already suffered heart attacks, because the over-the-counter painkiller market is a multi-billion-dollar cash cow. You are giving yourself a hypertensive crisis just to cure a mild hangover. 31. You've been convinced that high blood pressure is almost entirely genetic, and if your parents had it, you are doomed to have it too. You passively accept your diagnosis as a tragic family curse that you can do nothing about except take pills. Doctors love to ask for your family history and immediately use it as an excuse to reach for the prescription pad. The empowering pivot is that genetics only load the gun. Your lifestyle and diet pull the trigger. Epigenetics proves that while you may carry a gene that makes you sensitive to insulin or poor at metabolizing stress, you can completely turn off that gene expression by fixing your diet, optimizing your sleep, and moving your body. Blaming genetics was a highly convenient narrative pushed by the medical industry in the 1990s because it absolves both the doctor and the patient of doing the hard work of lifestyle change. It is infinitely easier to blame your grandfather's DNA than to admit your modern diet is destroying your vascular system. 32. You believe that blood pressure medications cure the underlying problem in your body over time. You think of them like antibiotics. Take them long enough, and the disease will go away. Patients religiously take their meds for decades, waiting for the day their doctor says they are finally healed. The horrifying reality is that blood pressure pills are purely symptom-masking chemical bandages that do absolutely nothing to stop the progression of arterial disease. They artificially force your blood vessels open or cripple your heart's pumping force, while the underlying inflammation and insulin resistance continue to quietly rot your cardiovascular system from the inside out. The pharmaceutical industry designed these drugs to be management tools, not cures, because a cured patient is a lost customer. You aren't getting better. You are just chemically hiding the dashboard warning light, while the engine burns. 33. You assume that a low-fat diet is the best way to keep your blood vessels clear and your pressure low. You buy low-fat yogurt, skim milk, and fat-free dressings, feeling incredibly responsible. The dietary guidelines of the 1980s demonized fat and practically forced the entire world to adopt this eating style. The metabolic disaster is that when manufacturers removed the fat, food tasted like cardboard, so they replaced it with massive amounts of high-fructose corn syrup and chemical stabilizers. This low-fat, high-sugar diet causes massive spikes in triglycerides and extreme insulin resistance, which directly hardens the arteries and drives up blood pressure. The origin of this nightmare was a combination of bad science by Ansel Keys and aggressive lobbying by the sugar and grain industries who wanted to dominate the supermarket aisles. You've been starving your brain of healthy fats while feeding your arteries the exact sugar that destroys them. 34. You think that your kidneys are only victims of high blood pressure, not the cause of it. You assume your heart is the only organ that dictates how high the pressure goes. Cardiology heavily focuses on the heart and the pipes, often treating the kidneys as a secondary afterthought. The biological truth is that your kidneys are the absolute master commanders of your blood pressure. If your kidneys become slightly damaged by high blood sugar or chronic inflammation, they lose their ability to filter blood properly and send out emergency hormones to crank up the blood pressure globally, just to force blood through their own damaged filters. Nephrologists, kidney doctors, know this, but the hyperspecialization of modern medicine means your cardiologist might just give you a heart pill instead of checking your renal function. You are drugging your heart to compensate for a kidney that is screaming for help. 35. You've been told that fasting is dangerous and will cause your blood pressure to crash unpredictably. You make sure to eat constantly so you don't pass out or stress your system. Dietitians and conventional doctors often warn against skipping meals, citing a need for balance. The twist is that intermittent fasting is one of the most powerful, rapid, and natural ways to lower high blood pressure permanently. When you fast, your insulin levels plummet to baseline, which signals your kidneys to finally dump the excess sodium and water they've been hoarding, immediately relieving vascular pressure. The medical industry is terrified of fasting because it is completely free, cannot be patented, and works faster than most of their entry-level drugs. They scare you into eating constantly so you stay trapped in the metabolic cycle that requires their pharmaceutical interventions. 36. You believe that if your blood pressure is high in your arms, it must be exactly the same everywhere else in your body. You trust that one arm reading is the absolute truth for your entire circulatory system. The standard clinical exam never bothers to check the pressure in your legs or compare both arms. The shocking fact is that a significant difference in blood pressure between your left and right arm, or between your arms and legs, is a massive red flag for peripheral artery disease or an aortic aneurysm. If the pressure in your legs is much lower than your arms, your arteries are heavily blocked with plaque. Doctors rarely perform this simple ankle brachial index test because it takes extra time, and the insurance reimbursement for a physical exam is abysmal. You could have a ticking time bomb in your chest, and they'll miss it because they only checked your left bicep. 37. You assume that menopause naturally and inevitably ruins a woman's cardiovascular system, making high blood pressure unavoidable. You resign yourself to taking pills the moment your estrogen drops, believing it's just the tragic fate of aging women. The medical establishment treats menopause as a disease state that guarantees hypertension. The empowering truth is that while the loss of estrogen does reduce vascular elasticity, the massive blood pressure spikes seen in menopausal women are almost entirely due to the sudden unmasking of decades of hidden insulin resistance. Estrogen acts as a protective shield that forces the body to handle glucose efficiently. Once the shield is gone, the bad diet you've been eating for 30 years finally wreaks havoc on your arteries. The pharmaceutical industry loves the menopause narrative because it allows them to sell blood pressure drugs to half the population simply for growing older. It wasn't your ovaries failing you. It was the dietary lies you were told in your 20s catching up with you. 38. You think that combining multiple blood pressure drugs is just advanced medicine and totally safe. You proudly take a diuretic, an ACE inhibitor, and a calcium channel blocker all at once, trusting your doctor's aggressive cocktail. Polypharmacy, prescribing multiple drugs to fix the side effects of other drugs, is the dark standard of modern chronic care. The terrifying reality is that stacking these drugs creates exponential risks of acute kidney failure, lethal potassium imbalances, and catastrophic sudden drops in blood pressure that cause deadly falls. Each drug manipulates a different vital organ, and the clinical trials rarely test how 3 or 4 of these chemicals interact together in a real human body over decades. Doctors stack these drugs because standard protocols dictate that if one pill doesn't hit the magical 120/80 target, you must add another, regardless of the systemic toxicity. You aren't getting premium care, you are an uncontrolled chemistry experiment. 39. You've been told that getting dizzy when you stand up is just a sign that your blood pressure is a little low, and nothing to worry about. You grab onto the table and wait for the room to stop spinning, assuming it's a normal quirk of your body. Doctors often dismiss this symptom, especially in patients already taking blood pressure medication. The physiological reality is that orthostatic hypotension, this sudden drop in pressure when standing, is a massive warning sign that your nervous system is failing to constrict your blood vessels, or that your doctor has severely overmedicated you. If your blood pressure drops too much when you stand, your brain is being chronically starved of oxygen, radically increasing your risk of developing dementia and Alzheimer's disease. The medical system downplays this because admitting that their medications cause brain-damaging oxygen drops would result in massive malpractice liabilities. They are saving your heart by quietly suffocating your brain. 40. You believe that the medical industry is aggressively researching a true, permanent cure for hypertension. You assume brilliant scientists are working night and day to make blood pressure pills obsolete. Pharmaceutical PR campaigns constantly boast about their commitment to eradicating cardiovascular disease. The cold, hard truth is that the industry abandoned the search for a cure decades ago because managing chronic conditions is the most lucrative business model in human history. Why would a corporation spend billions to develop a one-time cure when they can sell you a pill that you must take every single day for 40 years? The origin of this greed was the realization in the 1980s that blockbuster drugs, like statins and beta-blockers, could generate annual recurring revenue that dwarfed any surgical or curative intervention. They don't want to cure your high blood pressure. Your illness is literally a line item on their quarterly profit report. 41. You assume that a lower blood pressure in the elderly is always better, and that driving it down will make them live forever. You celebrate when your grandmother's pressure drops to 110/70, thinking she is the picture of health. The entire medical dogma insists that lower is unconditionally better, regardless of frailty. The ultimate paradox: massive epidemiological studies show that frail, elderly individuals with lower blood pressure actually have a significantly higher risk of all-cause mortality and sudden death than those with mild hypertension. When the elderly have low blood pressure, it often means their heart is too weak to pump, or their body is completely failing to maintain homeostasis. The medical elite ignore this data because admitting that a higher pressure is protective in old age shatters the universal 120/80 marketing illusion they've spent billions building. You are cheering for a number on a screen, while the patient is quietly fading away. 42. You believe the biggest lie of all, that once you go on blood pressure medication, you can never, ever get off it. You have been told that this is a lifelong sentence, and attempting to stop is a suicidal risk. Doctors repeat this mantra daily, instilling a deep, paralyzing fear in their patients. The ultimate mic-drop truth is that for the vast majority of people with essential hypertension, the condition is 100% reversible through aggressive dietary changes, fixing insulin resistance, and strategic weight loss. When you remove the inflammatory foods, heal the kidneys, and restore vascular elasticity, the body naturally regulates its own pressure, making the medication completely obsolete. The industry desperately pushes the lifelong sentence myth because patient compliance is the bedrock of their financial empire. You are not broken, you are not cursed, and you do not need their permission to heal your own body. In summary, what you've been taught about your blood pressure for the last 50 years is largely not science, but the result of collusion between corrupt nutritional policies, profit-hungry food conglomerates, and a pharmaceutical industry that feeds on your fear. They create the problem by destroying your natural food supply, then sell you the solution in the form of endless toxic pills. It is time to take back ownership of your body, stop fearing natural foods, and question every medical mandate sponsored by a corporation. Drop the myth I didn't cover below in the comments. If you felt validated and learned something new today, hit that like and subscribe button to join me in exposing the systems that manipulate our health. The truth is out there, so stay smart, stay healthy, and don't let them trick you ever again.